I like this question. What is Medicare Supplement Plan G? Let's go back to the basics. Before I get into the details of Medicare Supplement Plan G, let me give you the framework. So if you are starting Medicare and you're going to stick with the federal government program, Original Medicare, Medicare is not designed to cover every dollar. So with some dollar gaps on a Medicare approved claim, you have the opportunity to apply for a Medicare supplement policy, and depending on which plan you choose, that's going to determine how many of the different gaps are covered. Now, of course, the more the gaps you cover, the more expensive the premium is going to be. Now, if you take a look at this chart behind me, which you've probably seen in multiple publications, you can see this column all the way to the left is all the different possible dollar gaps. Then you look behind me and here are the different letter plans. There are additional plans behind the column that's titled G, but because we're just focused on G right now, that's where I cut off the document. So if you look at Plan F, which is the highlighted plan, the one in towards the right, you can see that every single possible dollar gap if a Medicare approved claim is covered. If you look just to the right of F, you're going to see G, and G and F are identical except for one benefit. That's going to be the Part B deductible. Now, F is no longer offered to new Medicare beneficiaries. G is your most comprehensive option, so I'm going to show you how it works. Now, you could approach this by simplifying and saying, okay, I know with G, anytime there is a Medicare approved claim, once I have met my Part B deductible, which is $257 in 2025, then I have no more bills that I should be paying a part of when it comes to Medicare Part A and B. But if you want to understand it, then let's take a look at this chart. Now we're going to start with Medicare Part A. That's what you're seeing behind me. Medicare Part A is your hospital coverage, inpatient hospital coverage. Now if you look to the top of the chart, whether you are in the hospital one night or up to 60, the Medicare Part A deductible in 2025 is $1,676. If you don't have a supplement, that's your cost. But if you get Medicare Supplement Plan G, it is covered. Now, the rare chance of being in the hospital, 61 to 90 days. So now you're outside of that deductible period. Now you have a copay that kicks in. And the copay is going to be $419 for days 61 through day 90 in the hospital. But because you have Plan G, it's covered, you pay nothing. The rare chance of being in the hospital past that 90-day period, now you have 60 reserve days. And with those reserve days, there is, I can't read it, there is a number there that is the amount that I don't want to say it wrong, but I think it's 638 or 838. I need my glasses. But in the meantime, the point being is that it is covered by G. And then if you get past those 60 days, Medicare's done. Medicare's not paying for more days during that benefit period in the hospital, but your supplement is going to pick up an additional 365 days. Now, if you're in the hospital beyond that, you're done. Medicare's not paying it, and neither is your supplement. In addition to inpatient hospital coverage under Part A, there's also skilled nursing facility care. In order to qualify for that, you must have at least a 3-day hospital stay, and then that's when you need rehab, skilled care. So what happens is days 1 through 20, there is no gap. Medicare covers it all. Now, how long you're going to stay is determined by the facility and your needs, but in the meantime, for days 21 through 100, Medicare covers all but $209.50 a day, but because you have G, it's covered, you pay nothing. After 100 days, you're on your own. Medicare's not going to cover skilled nursing care for you in a facility. Now let's look at Medicare Part B and how Medicare Supplement Plan G fills in the dollar gaps of Part B. So Part B is everything outside of the hospitals, doctors, labs, tests, etc., therapies. So before Medicare pays a dime of your bill, there is a $257 Part B deductible. That is a Medicare deductible. Medicare Supplement Plan G does not cover that deductible. Remember, I mentioned that is the one difference between F and G. So under this plan, you're going to pay the $257 when it comes due. Once you've paid that amount out of pocket, then your Medicare's obligation of 80% of your bill kicks in, and that's where there's 20% remaining. Under Medicare Supplement Plan G, they're going to pay the 100% of the 20% on a Medicare approved claim. No copays, nothing like that. Another benefit to understand is right here up above me, excess charges. So what am I talking about here? Well, 98% of the doctors who work with Medicare do something called accepting assignment. So that means that whatever Medicare pays, they accept. If they charge $1,500, Medicare pays it at $1,000, that $500 is waived. 2% of the doctors out there, and they say maybe a lot of them are psychiatrists, I don't have an exact list, do something where they can charge an excess charge because they don't accept assignment. So same fact pattern, $1,500, it's brought down to $1,000, but they can charge 15% over that Medicare approved amount. So let's say it's another $150. And you can see here up above where that green check mark is, that Plan G covers that excess charge. One more benefit to understand, I'm going to get my head out of the way. If you look right here, foreign travel. So we know Medicare is to cover your health in the United States. So what happens if you're in France and you're in Paris and you fall and you break your leg? Well, here's what happens. So Medicare is paying nothing. You're at the hospital, you're going to pay your bill, but you can get some possible reimbursement from your Medicare Supplement Policy Plan G. If the emergency happens in the first 60 days of travel, you're going to have a $250 deductible that cannot be covered by the supplement, and then the supplement will pay up to $50,000 lifetime of that bill, and you will pay for 20% of that bill. So there is that kind of coverage, but again, you go in for reimbursement. So in summarizing this, the simple way to approach it, Medicare Supplement Plan G covers every dollar of a Medicare approved claim for Medicare Part A and B, except for the first $257, which is your Part B deductible. You look at this, you're getting into the weeds a little bit. It helps you get an understanding of how it works. As to how it's priced, that is a whole nother discussion. It's going to be based on where you live, if you're male or female, if you're a smoker or non-smoker, do you get a couples discount? What's your height and weight, etc. So you can look into that based on your zip code and figure out if G is the right plan for you, or I can help you do it.